This is on sequential molecular screening methodology for the diagnosis of retinoblastoma. The diagnosis of retinoblastoma is often clinical. Radiology provides presumptive diagnosis. Histopathology can give a definitive diagnosis. Sequential molecular screening of RB is available only in few centers and is expensive, which remains a bottleneck. Hence, we aim to develop an indigenous and cost-effective method for the molecular diagnosis of retinoblastoma. DNA is isolated from the blood and the tumor samples wherever available using the suitable kits. The quantity and the quality of the isolated DNA is checked with qubit fluorometer and the agarose gel electrophoresis. Sanger sequencing and multiplex ligation dependent probe amplification, that is MLPA, is used to detect the point mutations and deletions duplications of the RB1 gene. Both the steps involve the amplification of the gene or the probe that binds to the gene, which gave us about 90% sensitivity. In addition, we do methylation specific MLPA for detection of the promoter methylation in RB1 gene, which gave us a 95% sensitivity. The next generation sequencing methods for the targeted whole exome sequencing were also done to detect the single nucleotide variations, that is SNV, and the copy number variants in additional genes other than the RB1. Library preparation using the specific kits was done at our own center. Data analysis was done as it is critical to identify the suitable variants. So this is the sequential molecular screening methodology and the instrumentation required for performing this task. And with all the methods and high throughput instruments in place, we complete the analysis starting from sample collection to report generation in just 3 weeks. The genetic analysis and counseling benefited 543 families with retinoblastoma. Patients with mutations, that is germline, were 305, formulating about 56%. Patients without mutations, that is sporadic, was 238, which was about 44%. And families with mutations were about 41, forming about 7.5%. If germline, their future siblings and offsprings have to be checked clinically and genetically. If there's no mutation in blood, it will not be inherited, is the inference. More than 100 mutations like nonsense, missense, frameshift, splice have been identified, out of which 20 are novel, and these mutations are being characterized for their pathogenic role. So there are some epigenetic factors as well, that is the promoter methylation analysis by MS-MLPA. The promoter methylation was identified in 4 of our patients, tumor but not in the blood. So this epigenetic event is somatic, which means there's less likely preponderance to inherit the mutation to the next generation. So you can see this particular scenario in the promoter region, there is methylation. It's a unilateral RB without any family history. This child had the mutation. So MICN amplification and RB tumors is another entity. The MICN is a well-characterized gene for RB. It is increased copy number of MICN has been found in many other cancers as well. MICN amplification with more than 10 copies was detected in 3 of our patients, correlating with the severity of the disease. So the copy number variations, analysis of unilateral RB tumor samples were validated and confirmed by the qPCR. Our next generation sequencing analysis has identified several candidate genes involved in the tumorigenesis. We found the gene amplifications of various genes, and these have been involved in the cell cycle regulation, cell proliferation, and apoptosis. Currently, we are studying the role of individual genes through cell culture models and trying to identify the suitable drugs to reduce the expression. The impact of this study has been seen in many families where the timely and cost-effective diagnosis have helped them in making informed decisions. Cost has been reduced from $1,800 to $150, and the time from 10 weeks to 3 weeks. Thank you very much.
Thank you. Very interesting work and a very large data set. The question I had was the germline mutations. How many of those were new germline mutations in the family, or?
There were about 41 families had.
And the rest were all spontaneous new mutations. Okay, that's a large number of mutations. And have you collected samples for cell-free DNA also, or from the blood or the aqueous?
We have been trying, sir, but
Okay.
we've not been very successful in it. But
Okay.
we are planning to do it. Go ahead
Okay.
with Aquis
Okay.
and CSF as
Si-
well.
Okay.
That's in the pipeline.
And there's a lot of data there, so I'm sure you will, at some point, correlate it to the clinical findings and
Yes,
other
yes.
things. Okay.
Yes, thank you. And it's also, we're opening it up for other centers as well, for other patients in the country.